of the brain that causes tics often causes other symptoms. So there's extra bits of electricity there that can fire off these sorts of movements, and that's what you see with the extra blinks and twitches. But they can also go to the part of the brain that creates intrusive thoughts.
Oh, right.
And what that feels like for the child is that they'll get a thought in their head and it makes them worry. And alongside that, they often get a thought in their head that gives them an instruction, do this.
Wow.
And if they don't worry, or if they don't do the instruction, it causes them discomfort.
Right.
And having those kind of symptoms is what we call obsessive-compulsive disorder. So the worries they obsess over, the compulsions are the instructions. And you know, in lay terms, we talk about OCD as someone who has to tidy things up. It's not really like that. Often these have very little logic associated with them. You know, they'll worry that this tree is going to fall down when there's no breeze, and they'll get up and they'll have to move. You know, they know it's illogical, but their brain is telling them to. With the compulsions, they have to do things a certain number of times, or symmetrically, or evenly, or in a certain way. And again, not because it makes sense to, but because their brain is telling them to. So it can be really afflicting, and before you explain to someone what's going on, it can make them feel like they're going mad.
Wow.
You know, and again, these are the reasons why I identify these things. Often I might see a child with ADHD and no one's even known that they have this because they don't tell people. They just have it in their brains that they do all of these instructions in their heads, and try and get through life without wasting too much time doing them. But it can be very reassuring to know, again, that it disappears by the time they get 18. So it's the same as the tics. They sort of peak around 11, 12, 13, where you change schools, hormonal changes in, you know, the way that you interact with other people, and then they tend to get better.
And they don't tend to go on medication for that kind of group?
Again, intervention for that is if the things that they're having to do or having to worry about interfere with life and functioning. Yeah. Okay. So for some people, they'll just get the worry about the tree and they'll be able to dismiss it and think that this is silly, let me not waste time doing it. Other people, it will go round and round and cause them distress. And if it's causing distress, or with the compulsions, if it's taking up hours of their time, because there's some kids I've seen where their bath time routine will take them 2 hours.
Wow.
And of course, they don't have 2 hours in their day they can spend. At this level, we would treat, first of all, psychologically. So there's a very good evidence-based form of psychological treatment, where essentially you make a list of all the things that affect you in this way, and then start with the easiest ones and try not doing the things, try and resist them, or try and think of the worry and tell yourself it's going to be okay, with the psychologist's help, and then build up as you go. If the anxiety is too extreme to do that, you might take a medication, an anti-anxiety medication to help with that. And it's a bit like someone with a muscle injury. They've been asked to do physiotherapy, but the pain is too high for them to do the exercises. They might take a painkiller. It's not the painkiller that gets rid of the injury, it's the therapy, but they need that to help. So it's a combination of the two.